I bent down to simply pick up a box and threw my back out. Felt, an extreme pressure and sharp pain on that right side. And barely, by the end of the day, really could not function twisting or bending at all. And it progressively got worse, really limiting what I was able to do. Could not bend or twist, was unable to sleep comfortably. And then 3 weeks later, I went on a pretty leisurely walk through the foothills, and the next morning is when this condition really exploded, and felt just excruciating pain immediately from spinning my legs around the bed and trying to get up. Just incredible nerve pain, stabbing, any movement, walking, trying to lift my legs with steps was incredibly painful. So this condition affected my daily life tremendously. I could no longer perform my job. I actually had to take a leave of absence. I couldn't pick things up, I couldn't twist, I couldn't bend, and the leg pain was just too severe. So the treatment that I received at 33 Chiropractic was incredible. I felt instant relief after the first treatment. The leg pain started to subside a little bit that first day. Every day was better. Every treatment, everything got a little bit better. And it was probably just after week 1 that the leg pain was completely gone. I would absolutely recommend treatment at 33 Chiropractic and the flexion distraction for anybody that has disc problems or back pain. It was the perfect treatment for me and truly got me out of pain, and has just changed my situation tremendously. So absolutely would recommend 33 Chiropractic in that treatment.
So Lindsay was one of our many cases when a patient comes in with an intervertebral disc herniation. And disc herniations are not only very serious, but they're a very painful condition as well. Now, people suffering from this condition might be thinking, oh my God, I'm in so much pain, I'll probably have to have surgery. This is going to get really expensive. I don't know how much work I'm going to have to miss. But here's what I'd like you to know about disc herniations. So firstly, we have to start with the anatomy of an intervertebral disc, and we have 2 main parts. We have an inner portion of the disc called the nucleus pulposus, and the outer portion of the disc called the annulus fibrosus, or annular fibers. Now, when we have a disc herniation, what happens is the outer portion of the disc, the annulus fibrosus, basically has fissures in there that allow the inner portion of the disc to herniate outward, and basically what happens then is it nicks on a nerve and gives you this awful radiating type pain down your leg. Now you might be asking yourself, how do we go about fixing that? Well, at 33 Chiropractic, we fix intervertebral disc herniations with a technique called flexion distraction. Basically, we put you on a very particular table, and what we do is we axially distract your spine this way, and we flex it forward. And we do this over and over and over again, and through a series of visits, what happens is that inner portion of the disc, called the nucleus pulposus, basically gets sucked back into the center of the disc where it belongs. Then after that, all that pain goes away. What happens is we use a very powerful laser device, and we basically heal up the outer portion of the disc, and those cells heal and trap the inner portion of the disc back where it belongs. Next, you might be asking yourself, well, what do I do if this happens to me? Well, first and foremost, let's always use surgery as a last-ditch effort to fix this problem. Now, as a chiropractor, I'm very thankful for the surgeons out there, but we all know that about 85% of back surgeries 5 years post-surgery can kind of go south on us a little bit, and at that point you might have permanent unrelenting pain, which then certainly adds to the opioid epidemic that we've been having in our country. So always go to a holistic doctor first for this problem, and of course I suggest coming to 33 Chiropractic because our office is built for this type of scenario. Now you might be asking yourself, well, what can I expect at 33 Chiropractic, and how much is this going to cost me? Well, you can expect a very thorough evaluation. We'll go ahead and tell you exactly what's going on with you and how we intend to fix you. And how much is this going to cost? Well, that really depends on the case. Fortunately with Lindsay, it only took a couple of weeks and she was back on her feet and good to go and back to work. Now, there are some tougher cases out there, but rest assured, at 33 Chiropractic, your care will certainly be much cheaper than going the surgical route, and there are absolutely no side effects whatsoever, so you really have nothing to lose. And lastly, you might be thinking, well, just how effective are these therapies? Well, at 33 Chiropractic, luckily we have never failed to fix a case of a disc bulge or herniation, provided the patient listened to our recommendation.